I'm Becky Meagher, and welcome to Transitions, Body, Mind, and Spirit. Transitions. We have many transitions in our life. The metaphor I like to use is something I do, which is triathlons. You swim, and then you have a transition time, and then you bike, and then you get to the transition time, and then you run, and then that's the race. And so life has many transitions. Part of it is your sex life. What a thought, your sex life. Remember when you were in your 20s, it was one way, your 30s, it was a different way, your 40s, and maybe you're in your 50s or more. So we have a very special guest, an expert, a worldwide expert, really, I think, in sexuality, and it's Ginger Manley. Thank you for being with us.
Thank you, Becky. Glad to be here.
Ginger has so many credits that I actually have to read it because there's just so much. She is a nurse, psychotherapist, and sex therapist. She has over 30 years experience practicing and teaching in the field of sexual health. Her specialties include sexual addiction, sexual trauma, sexual dysfunction, sexual boundary issues. She retired from private practice in 2005. However, she presently is an associate in the Department of Psychiatry at Vanderbilt University in Nashville, Tennessee, and she works with the Vanderbilt Comprehensive Assessment Program, which works with professionals in the Center of Professional Health at Vanderbilt. She's also board certified as a psychiatric mental health clinical nurse specialist and is a certified diplomat in sex therapy. And she also has a new book coming out, which we are going to be talking about. It's called Assisted Loving. Assisted Loving. The Journey Through Sexuality and Aging, Ginger Manley. Ginger, I first want to talk about your background. You have been doing sexual therapy, health issues for 30 years.
Right.
Back when people didn't talk about it, and I'd like to know how and why did you even decide to go into this specialty?
I will say that it was not my childhood dream to become a sex therapist. There were not any sex therapists. In fact, as far as I knew, sex didn't exist when I was a child, except that obviously it did and had for centuries before, but there was no dialogue about it except thou shalt nots, and I got a lot of that growing up. I became a nurse and really thought I would be a very traditional nurse, and I was for a while. I worked in hospitals and intensive care units and all of that, and then in 1974 I had an opportunity to become one of the country's very first nurse practitioners, and that was before anybody really knew what a nurse practitioner was, including me, but it was just something new and different. And so I decided that that's something I wanted to do. And as a part of that, of the education for that, we had faculty who were looking really quite ahead of their time when you consider things, but they said, for the very first time that I'd ever heard it said, that people in the healthcare field ought to pay attention to the sexual needs of our patients, because so many illnesses and so many kinds of surgery and so much medication really affects a person's sexual functioning. And I thought, well, that's really new and novel. I think I'll learn some more about that. And there weren't very many books then. There was The Joy of Sex, which was what all of us had on our bookshelves. Maybe we had a few other things too, but there weren't too many. There were the Masters and Johnson's first books, but that was just about all there was. But I read every page of all of that, and looking back, I've always been really curious about sex. I couldn't wait for National Geographic to show up in the mailbox when I was a child, because maybe they'd have some pictures of naked people in them and I could see what people's bodies looked like. And my friends and classmates say, you were always the one who was asking the questions and trying to find out about things, but there weren't many people to ask. So really, from both my own perspective of being curious, and then secondly, from the standpoint of working with people with illnesses. And so I moved to Nashville after I finished my program and began to work with an endocrinologist here who we saw many, many people with chronic illnesses, things like diabetes and hypertension and all kinds of other illnesses. And if I asked them the question, are you having any concerns about your sexuality? Bingo, many of them did, and most of them said, no one's ever asked me that before.
I think people don't even ask that now.
Right.
Your
right.
doctor doesn't ask you about your sexual health.
Right. And so from my standpoint, that became something like, well, why don't people ask about it? I mean, nobody dies when you ask about it. Excuse me. And why don't we ask about it? And then what happened was that they held me accountable. They started to say, so you've asked about this and I've told you that something is going on. What can we do about this? And this was in the 70s. There were not any medications. We didn't have good ways to evaluate people. We just had their stories. And so I began thinking, I need to know better how to at least talk with folks about it. So that started me in 1981 on my quest to become better at this, and a whole new niche just opened up for me in the world of healthcare. And that's what I've been doing since then.
Wow. So when you got to Vanderbilt and then you became a nurse practitioner and then you became a specialist in sexual issues.
Right.
And then you also opened up a private practice.
Right. Well, first I opened a practice at Vanderbilt. That was the very first, and today still is the only practice that they had. They had it for 4 years, called the Center for Sexual Health, and that was me.
That was you.
That was me.
Okay.
There was nobody else there, but I was busy every day, and we had a waiting list for 6 months. And this is back in 1985 in Nashville, which is a pretty conservative, pretty traditional place that people are not necessarily just asking all the time about sexual issues, but we had a very robust practice, and I decided to leave Vanderbilt in 1989 and go out into the community, and in several different settings, then had a private practice until, as you said, I retired from practice in 2005. And I was as busy as I wanted to be. I saw so many interesting people. I had opportunities to hear stories that time after time people said, there's never been anybody else I could tell this to, nobody else I could ask this to. I hope you won't think I'm crazy, but this is what's going on with me. And just people very genuinely wanting help and not being able to find help. And so I felt very privileged to be able to be a part of their stories and to be able to help them along. And we still didn't know as much. I mean, in the last 10 years, there have been tremendous changes that have happened in the whole field of what we now call sexual medicine. We didn't even have anything called sexual medicine then. Now we have so many more ways of evaluating and treating people. Obviously, we have Viagra, which has been out now for 15 years.
Has it been 15 years?
It has. And so I was there for a long time before that, and now we've had that for a long time. And but you can't fix things just with a pill. I mean, it takes a lot more than that. So that's where I was able to help people to look at what was getting in the way or what would enhance things. And so it was just really a rewarding practice. And now I teach as much as I can. I teach that to a younger generation. And I've been working with people with aging issues from the standpoint of teaching them and writing about these issues.
Well, I believe your book is actually taken from, there's a magazine here that people can write in, and kind of like the Dear Abby of sexual things. I'm having a problem with my husband or whatnot, and then you will answer in this column. And your book is kind of compiling all these years of answering the sexual questions. But but the magazine itself is Mature Lifestyles?
Mature Lifestyles, right. It was started by a woman in her late 70s.
Late 70s?
She was in her late 70s. She had run newspapers before. She'd gotten out of it. She'd been widowed, and she decided, well, I'm not through with this. I need something else to do. So she started this newspaper herself on a shoestring in Lebanon, Tennessee. And it had been going about 2 years when I contacted her and said, said, you know, I think that maybe there might be a place for a column about sexual issues. And she was very responsive, but it took almost a year to work through all the, as she put it, the powers that be before they accepted me and said this would be okay. And then I began to write in March of 2009, the column, and I've written one every month since then. Not every question has come from people who have responded to the newspaper, but every question is a real question that someone somewhere on the golf course, in the grocery store, through email, wherever, have asked me. So I know that these are real questions and I consider them dialogues that I've been able to have, even if I've never met the people. And so I chose the name Assisted Loving for it.
Assisted loving.
Assisted loving. People say, does this have to do with assisted living? And the answer to that is, well, it could, but mostly it's about that we're not quite ready for assisted living. Many of us are not, but most of us after the age of 50 need some help with, some assistance with our loving. And so I call it assisted loving. And among the people who've heard that enough, they tell me now that in lovemaking, and as they are in whatever situation they're in, they may say, so we might need a little assisted loving now, and that might mean they need to use some medication, they need to slow down, there could be all kinds of things that they might do. But the term assisted loving, I'm hoping will catch on, and people will, rather than saying, oh my gosh, my sex life's over, they could say, I need a little assisted loving now. So. And most people have been pretty receptive of the title.
Well, I find it fascinating that you, in your book itself, you kind of go through these letters to you, but also, like the first part is about relationships and how important it is to be in a good relationship with that person, whoever that is, at whatever age. But particularly, there are some things you talk about, kind of tongue-in-cheek, but your version of oral sex. Tell us about that.
That is, I always get people's attention when they hear that particular phrase. Many years ago, in talking with my patients in the office, I would be talking with them about you need to have more communication. And one day, just kind of blurted out, you need to have more true oral sex.
True oral sex.
Okay. And the person's eyes got great big, and I went, my goodness, I'm not sure I should have said that. And they said, well, what do you mean? And I said, true oral sex is when we use our mouths to talk to someone else's ears and we communicate. And I said the biggest problem that I see in people of all ages is not so much that their bodies aren't working the way they want them to, but that they don't know how to talk about this. And about sometime in the last month, I got an email from someone who had heard about my book and had been watching for it to come out, and he said, I'm so glad that you wrote this, because he said, in my years growing up, and I don't know how old he is, I'm guessing he's in his 70s, he said, the only communication was in the back seat of a 57 Chevy, and we were just trying to get it on, and he said, it was either ugh or ooh or ah or maybe yes, and he said we never wanted to hear no, and that was the only communication that was there. And he said, thank you so much for helping us be able to get some dialogue going, some true oral sex going. And this is sexuality at a later life is all about fun. You don't have to make babies anymore.
Right. And you don't have to worry usually about having a baby if you're past menopause, right?
Right. Well, the guys might have to worry because depending on the age of the person that they're with, but for the most part, those worries are over. So it's not so much about that, but it is about having fun. There's not really much purpose in having sex later on in life if it's not for fun. And that is one of the reasons we have sex, for procreation, to keep the species going, and for recreation. So sex in later life is about recreation, about having fun. If we can't have fun, if we can't laugh, then it's really pretty sad that way. So I'm trying to get people to have a little sense of humor and at the same time to have more information. So true oral sex is something that I encourage. I say, drive down the interstate with your friend or spouse and have true oral sex as you're going along, and they go, would that be dangerous? Well, no, I don't think so, not in the way that I'm talking about it.
Well, you talk about communicating oftentimes without being in the moment. You're sitting, like you're saying, or in the car and saying, I believe in your book you said, just talk about the positive things first, and then you can go into, well, this might work a little better, or this might work. The one thing I noticed in your book, you didn't use the words kissing. I didn't
say
see much
kissing in
kissing in
Well,
that.
my goodness, I'll have
And
to
that's
go
a
back
personal favorite of mine.
I'll have to go back in volume 2 and do more
Yes,
on that.
I was like, because that is a huge personal favorite for me, and men need to realize that there's more than just the grope, grope, poke, poke.
Absolutely.
You know, and kissing is such a sensuous thing that could be incorporated into. The one person in your book said, I'm with this man and he's 70 years old and all he does is kind of kiss me and it's okay, but then he just looks at me in Google eyes. He doesn't know about foreplay.
Right.
And that what you're talking about communicating is communicating, you know, this is what I like.
Right.
But I don't think people have the words to go know.
No, they really don't. And foreplay is actually a term that I don't use very much anymore. I talk about warm up.
Warm up.
That warm up is nice. Foreplay sounds like something that our parents maybe did and maybe did for a few minutes and did quietly. So let's talk about warm up here. And what helps you get warmed up, and what helps me get warmed up, and what could we do together that would be fun? And so kissing is just a whole lot of fun, and it's more than just a little peck for most of us, but for many people that's been the kind of kissing they've experienced. So let's say that you've been with the same person for 30 or 40 years, and for whatever reason you're not with that person anymore, but you meet a new person, and that person is all about kissing and touching and all kinds of things like that, but you haven't had that experience. Well, that's a real difference, and those kinds of things can be things that really are stresses on relationships. So that's why I think people need to have true oral sex to talk about. Well, I'm not much of a kisser, but with a little help I might move a little more into kissing, and maybe I would even kiss with my mouth open, as opposed to just with my mouth closed. And
I would never consider not having your mouth open.
And the other person says, well, gosh, I kiss not only with my mouth open, but in every other part of the body, you know. And so they might really think there's something going on there, but they're pretty far apart about what their life experiences have been. So sometimes what I did with people was just kind of help them to find some common ground and a place that they could begin safely enough. And that's always important, that it's safely enough for them to be able to take the next small step. Sometimes the next small step was literally just having the lights on, because there are people who've never had sex other than with the lights out. And so
they've always had sex in the dark.
So I mean, everybody brings to whatever stage they are in life, whatever their experiences are, and some have had, even in this Enlightenment era, they've had pretty sheltered kinds of experiences. Others have had way more experiences doing way more things than they ever probably that were good for them, and so it might be unusual for those two people to meet each other, but through Match.com and all the other ways that folks meet now, you never know. So that's where it's really important to talk about this. And also talk about what the other person's backgrounds have been, not just with what do you like and what do you don't like, but talk about STDs.
STDs, that's really been in the news.
It has been.
Different celebrities.
Right.
And tell us about that, because I had heard that people in their 70s and 80s are getting STDs that it was never even on their radar.
Absolutely, that's one of the things that's happening now in some of the older populations that are living in particularly in communities where it's mostly older, and all of a sudden STDs are becoming the thing that the primary care doctors are seeing the very most there, and it's going, what is this about? Well, it's about people who thought they didn't need protection anymore. Maybe they've never been with anybody else, and now they've moved there from we'll say California, and somebody else has moved there from New York, and they bring with them all the things that they may have gotten from other partners. And but if they don't talk about that and they don't plan on using protection, and they don't, I have somebody in here who says, I've met this man and he's been around the barn. That's how she described it. And
Around the barn.
and I need him to use protection, but I'm scared to ask him to do that because I'm afraid he'll go away. Well, she's being pretty savvy to say, I need him to use protection. And actually many physicians now are finally being, because Medicare is requiring it, that they ask about STDs in people who are older. It's the first time that they've ever been required to ask anything about sex related to older people. So I'm hopeful that over time they'll maybe ask some more questions. But they need to ask, are you using any protection? Do you need to have any protection? Do you need information about this? Because people are they're getting HIV, but they're also getting some of the standard just things like chlamydia, and they're getting the kinds of things that have been around forever. There are about 60 communicable diseases that you can get that are passed on sexually, and people are getting all those. So it's important to use those, to use protection. And
do you recommend that that people, when they get their, I know women get their yearly gynecological checkup, and like when I go and see mine next week, after I read your book, I thought, I better make sure. I mean, I think I'm fine, but I've never had a problem, but I'm going to get checked for everything. And do men do that? Do they
Hardly
every year see their doctor, and are they even on the radar to, well, check me for STDs?
I can't imagine very many men who do that on a regular basis, because men in general are not very good consumers of health care like women. They don't go in on a regular basis. And secondly, unless there's some kind of discharge or some kind of sore on the outside, men tend to not think about that very much. But men sometimes are carriers without having any obvious signs, and a woman can, and the same thing can happen. A woman can be a carrier without having an obvious sign. So it is important it's important to have that conversation and to talk with your healthcare provider about what needs to be done and what needs to be checked. And
are you, the surprising thing, I mean, people in their 80s, I didn't think about people in their 80s having sex, but I know you had a class at Vanderbilt and have another class at the OSHA, Vanderbilt, and there were like 100 people, you said, in your class, and I guess there are people, is there an age limit? I mean, is there a limit that men can't have erections or women don't have orgasms, or does anybody even know that information?
Well, actually we do. We have pretty good studies that show sort of what the normal pattern is in the United States. One of the best studies was done in 2010, and it looked at people between the ages of 14 and 94, which is a pretty broad range.
Broad.
And it looked at people across all household incomes. They thought they got about 98% of the population. More than 30% of that group came from the South. So we were more represented than any other part of the country in the study, and it showed certain things that we already know, and that is that erections change over time, orgasm changes over time, desire changes over time, but what it also showed that there were certain things that made a difference. For instance, women, the take on women is that women are not very interested anyway. Now, we all know that that's not true, but that's the perception of a lot of folks. But especially that women over a certain age, women over 50, women over 60, certainly women over 70 are not very interested. I mean, don't think of your granny being, a real sex person, but your granny might be a real sex person. Mine wasn't. Mine was very sexually averse, and that's how I got taught about sex, was through a lot of that. But other people's grannies are not. But what it showed was that women might say, I'm not very interested, and all of a sudden, lo and behold, a new person comes on to their radar, and they begin a relationship. And 80% of those women who said, I'm kind of at a 0, they went to a 10 just because of a new person. So never underestimate.
It's never too late.
It's never too late. And And within couples, what's very interesting is that if a couple has been doing the same 3 things over and over for 55 years, that gets a little boring. And if she happens to meet somebody and you know, why would Granny run off with a boyfriend when she's been with Grandpa for 55 years? Well, maybe this new person helps awaken some things in her. So what I try to do in working with couples is to say, so if you want your relationship to stay intact and you're happy with that, let's try to find what it is that's going on that's making it boring, and let's try to spice it up a little bit. And that doesn't mean we have to go to alternative things. It doesn't mean you have to get into kinky sex, but there are a lot of things like kissing. What if you had a prolonged kissing experience and you just were kissed, or you were the kissor? What about that? What would that be like? And so so it's within people's safety range, and some people have a broad range of safety, what they're comfortable with. Others have a pretty narrow repertoire.
I know you had mentioned in your book a lady that got her boyfriend to get new boxer shorts.
Right. I really got a kick out of that. She said, we got married late in life, and she said, once I kind of got into his underwear drawer and saw what he had, I said, this is never going to work. We have to get some things to spice things up here a little. And when I met them, she's kind of winking and grinning, and he says, I have them on right now. And it was really cute.
Wow.
So you don't think about that. I mean, who thinks about it? Our society desexualizes people really over the age of, for women, over the age of 40. I mean, 40's downhill after that. Men get a pass. There are men who are seen as sexual certainly into their 50s and 60s, and few into their 70s, but not in general. So lately we've had a few good role models of women, older women. We had Meryl Streep playing the role in Hope Springs, and we've had, there are other sexy, there are other juicy women, but oftentimes they're seen as being cougars. They're seen as something that is society might look down on. But the reality is there's a lot of vitality in women throughout their life, and in men also. And so I think we're going to see over the next 15 or 20 years a real change as baby boomers age, as the population becomes more gray. And I'm hoping people will take to heart that they can use some assisted loving and enhance and enjoy their experiences.
And assisted loving, amen. I'm all for that. This is such a broad and wonderful subject that this is part 1, and stay tuned because we have a second show with Ginger Manley that will go even deeper into this wonderful, amazing subject that we all want to know about. So thank you, Ginger, for being with us. Transitions, stay tuned. We'll be back.